Good afternoon and welcome back to this teleconferencing session. In this session we shall be talking about BNS 109, that is Community Health Nursing, and we shall be talking about Block 4, Community Health Nursing Administration. The topic for today's presentation is Concepts of Community Health Administration and Management. To discuss this topic we have Ms. Santosh Mehta, who is Senior Faculty, RAK College of Nursing, and we have Mrs. Rita Devi. She is also a lecturer in Nursing in School of Health Sciences, IGNOU. I welcome you all to this session, both of you experts. To begin with, I will request Mrs. Mehta to start the session. Mrs. Mehta, this community health nursing administration is an important component in healthcare delivery system at all levels.
Yes.
So what exactly is this community health nursing administration and what are its objectives?
Correct. Thank you, madam. Actually, community health, as you have already had your theory counseling plus your earlier counseling teleconferencing session, you have learnt about basic concept of community health, what is community health, and what all are the types of services which are there in community health. And you all know that health is our fundamental right, and the healthy people are contributing to national progress. So health is also fundamental in national progress. It may be any country, the healthy people contribute to good socio-economic development of the country. So community health administration means getting things done in the community health nursing field or community health field. And community health administration is activity.
Yes, Hyderabad, yes please. Please speak. Yes, Hyderabad.
Good evening, ma'am. Madam, regarding our behavioral sciences result. Hello, madam. Last time you told no, if you get all together 50% in term and examination, you are declared to be passed, done. But we are in our grade card we are getting not completed, ma'am.
No, you will be soon getting, it is under the finalization, you will be soon getting the final results. Because it had to be finalized for the first
Madam?
time.
Hello?
Yes?
Hello?
Yes?
We are getting, but all, madam, we are getting all not completed, madam. In
No,
grade card.
you will receive it within a shorter period of time. Whatever queries were there, we have solved the queries. And there was some problem in behavioral sciences, and it was to be, the grade card was to be finalized for the first time. So whatever queries you have, we have already solved, and you will be soon received, because there is no practical examination for behavioral sciences.
Okay, thank you.
So if you have secured 50% marks in theory, you are passed.
No, I think what she means is all three subjects of theory total should be 50%.
Yes.
That is what she wants to clarify. And in the subjects where they have achieved less than 50, they write not completed. Like for example, educational psychology, they have less than 50, it will be in front written not completed.
They had some problem.
So that confusion is there among students.
That is
even Delhi students, same problem they have.
No, but that is overall.
Okay, that's worked out. So that's good. Thank you.
Okay.
So community health administration, which we were talking, is the activity which aims to achieve better health of its people. So ultimate goal, or you can say purpose, is to achieve better health for its people. And Indian government, which is committed to providing community health services to its people. And in Indian scenario, we have health as a state subject because each state has its own different community health needs. Then community health administration is a branch of public administration. So whatever general administration or whatever public administration, it is just a section of that only, community health administration. So administration means getting things done, and many people use this administration term synonymous to management, and management means purposeful and effective use of resources. Resources are man, money, material. It is, by purposeful we mean that all these resources which are being used are there, behind this there is a purpose, and which means manpower, material, finances for achieving the goals or fulfilling the objectives. That is what predetermined objectives, that is what we mean by management. And to achieve at a broader angle, we have the community health administration. Now community health administration, if you want to define, it means art and science of organizing, coordinating the government agencies whose purpose is to provide community health services and to have physical, mental, social well-being of its people. So that is what we mean by community health administration. I think just to give a relevant example, now we have these community health centers, or in the rural health setup we have the rural health training centers, primary health centers, sub-centers. The community health administration is coordinating the activities of these government agencies which are aiming at providing these community health services. So I think community health administration, the people involved are the community health team members, which may be the medical people, nursing people and paramedical people who are there. Like for example, medical officer is there at a primary health center level, then at the sub-center level we have the public health nurse or ANM, whoever is responsible for those places, they do the community health administration.
It is done at various levels.
Various levels,
Like
yes.
it would be, say, FRU, CHC,
Yes.
PHC, and then then at the grassroots level will be sub-center.
Correct.
What are the objectives of community health administration?
Yes. Objectives of community health, as I was trying to explain the concept and definition, I tried to say that it is seeing to how services are given to the people. So ultimately, why are we giving services? Our objective is to increase the life expectancy of people. When we are giving health, when we are providing health services, the people will have less diseases, they will have a better quality of life, and there will be increase in life expectancy. As you must have known from your national data or your state level data that life expectancy has increased, and it is as a result of good or better community health services. So one objective is to increase life expectancy of people, then to decrease morbidity and mortality. When we can prevent diseases, we will be able to increase the lifespan, and simultaneously we will be able to decrease the infant mortality rate, maternal mortality rate and crude mortality rate, and also look into the decrease in birth rate. So that's another objective we have in providing community health or of community health administration. Then to increase physical, mental, social, spiritual well-being of people in the community. Because the community health services include these aspects, which is called as comprehensive healthcare services. Then provision of healthcare to the people to improve their quality of life. When we talk of quality of life, if the quality of life is good, naturally we will be able to prevent ourselves from the diseases. By quality of life we mean basic facilities are available, like housing, food and good clean environment and other resources to live with a better quality of life, and it is resulting in better health, better social life, and it will help in having better quality of life. Then it is also aiming at providing primary health care services to all. You have in your first year already learnt about primary health care services. So community health administration aims at providing primary health care services to all at all levels. Then also it helps in development of manpower. Whatever services we are providing through community health agencies, these are provided by the community health manpower, which may be the community health nurses, which may be district public health nurse officer. They are the people who are at the headquarter level may be available, but at the grassroots level you may have auxiliary nurse, midwife, multipurpose health worker. Different states have different designation people working at the grassroots level, but ultimately what are we aiming at? Helping these people who are working in this area to be updated with the recent trends and recent developments in health and disease. So the development of manpower is also one of the objective of community health administration. Then implementation of effective measures of surveillance and evaluation. When we are talking of improvement, improvement is based on what results we have already achieved or what programs we have implemented, what is the feedback we have. If we have implemented any program in the community, if we monitor it, do the evaluation, keep a close watch during the progress of that program or implementation of that program, we will be able to know how successful is that program, and based on that we will be able to plan future programs, or we will be able to effectively plan implementation of other programs. So it is also one of the objectives to have implementation of effective measures of surveillance and evaluation. Surveillance and evaluation may be done by different means. So we want to have those effective measures which will show us the impact of any program in the community. For example, if it is a RCH program, the objective of RCH program, main objective is to improve the quality of life of women and children, which may be through by reducing infant mortality, infant morbidity, better maternal health. So all these will be in terms of the data which we will have, which will be health indicators for maternal and child health, which may be through surveillance and evaluation, which we have used for evaluating these programs. Then all these programs are based on planning, and planning is done by the health personnel, and policy making is also done by the health personnel. So community health administration also contributes in policy making and planning for future. So I think these are some of the objectives of community health administration.
Rita, the ultimate aim of community health administration is to implement health programs effectively. Yes. And in order to achieve that effective implementation of health programs, the community health administration is based on certain principles. Yes. What are those principles?
Yeah. Thank you, ma'am. Principles of community health administrations should be based on sound principles for effective implementation of various health programs. Some of the principles which I would like to highlight, number one is there should be a sound national health policy. The national health policy, as all of you might be knowing, it is approved by Government of India or Parliament, which provide political commitment and support for any national health program. And when the national health policy is sound, objectives are clear, then only the administration will be effective. So this is the first principle. Then second, the sound health administration structure may be designed for the implementation of the health policy. If the organizational structure is clear from the top to bottom and from bottom to top, who is answerable to whom, that will be making the program very effective. Like for example, in revised National Tuberculosis Control Program, now it is clear for the TB health visitor or DOT provider that for the complete cure of the patient, it is not the patient is responsible, it is the DOT provider responsible for the completion of his treatment. So he knows that he is answerable rather than the patient. So he has to take care to whom he is answerable. So next principle is sound and systematic planning of health programs. All health programs needs a systematic planning. If the planning is good, then only it can be implemented and can achieve its goals. Next principle, there should be integration of preventive, promotive, curative and rehabilitative services at all administrative levels. I think these words are not unfamiliar now, so I will not discuss much. Then health should not be considered in isolation from other socio-economic factors. Like health is a multifactorial task. You cannot just be healthy in isolation. You have certain factors which makes you healthy. So you have to think about that whenever you are taking care of the health. There should be centralized directions and decentralized actions. This means that all the planning is done from top to down. There are clear-cut directions. Who is answerable to whom? Who will be doing which kind of work? At the same time, the activities which are carried out at the downward level, he also knows that from where he is going to start his action. These things should be clearly stated so that everybody is doing effective work. Then health opportunities need not to be related to the purchasing power of the people. They should get the facilities not by measuring how much they can spend. They should be given health facilities according to their accessibility and affordability. Next principle is planned health program should be based on the priorities and must meet the health needs of the people. If the priorities are not met, then the purpose is not solved. So priorities in relation to health are very important, which should be taken care of. Another principle is ensure basic health services available, accessible and acceptable to the people as close to their homes as possible. Like for example, in RNTCP program, DOT centers are provided within 1 kilometer range from the patient's residence, so that they are easily able to go 3 days in a week and get the medicines, rather than if they are far away, so they won't be able to go and get their medicines. So these things are to be taken care of. Then health consciousness should be fostered through health education, which is the most important component, because health education provides awareness not only to the patient but to the community, families, individuals, and if they are aware, then there is no way they will be able to catch the disease. They can prevent it from the very beginning. Another principle is doctors should be trained to act as social physician. They should not only just prescribing medicines, they should understand the problems of the communities as well. Then only the targets can be achieved. Understanding can be there between doctors and the community. Nursing and other allied health personnel should be given community-oriented education in their curriculum. As all of you, whether you have done GNM or you are post-basic or you are a DNA student, everywhere community is the integral part of your training. You are doing community visits as well as upgrading your knowledge related to the community. Then new category of health personnel should be given suitable training to provide proper services to the people at their level. In new category of health personnel, as you know nowadays, National Rural Health Mission program is new, as well as under this program ASHAs, accredited social health activist, is given training under A&M, they are working in the rural area. So any new category of personnel, another new category is the public health managers are coming up in the community, who are also looking after the same goal as of the community health administration. Then medical education can be reoriented and medical services recognized with the involvement and cooperation of the political and social scientists. As you know, medical education also from the curriculum of MBBS, they are also getting community health training from first year till 5 years of their MBBS program. So they are also actively involved. At the same time, all the systems of medicines, other systems, like we say indigenous system of medicines like Ayurveda, Unani, Siddha, homeopathy, they are also to be encouraged to provide decent health to the people in coordinated fashion. They are also not just working in isolation, they are also part of the community, and some of the people have faith in these systems also. So they are also to be encouraged because of the faith in them, people are getting treated, and there is no problem to them to accept these systems. Then utilize community resources and encourage local participation to self-health programs at village level. People have to be made responsible for their own health needs, and for that community resources in the form of like we involve Gram Panchayat, Panchayati Raj. From them we can take help for providing social activists, community volunteers, as well as they provide some infrastructure also if we want to organize some health camps, health melas. So they are part of the program for community participation. Then there should be provision for proper facilities and desirable working conditions to the health personnel. If the health personnel will not get facilities, how they are going to work? So they should be provided minimum acceptable, desirable facilities so that they can take care of the patients in the community. Then health services should be organized from bottom up and not from top down. The health services organization should be like what people need at the grassroots level. It should be organized according to the needs of the people, rather than the directions are coming from the top and people are not benefited. So it should be taken care of.
I think what they mean is that whatever are the needs of the people, it should
yes.
be assessed, and based
Okay.
on that at the top level the planning should be there.
Yes.
Like for example Pulse Polio program, we have directions from the top that the program has to be launched, but time to time they keep collecting data, and wherever there are new cases they intensify their program in those areas. So I think that is what we mean by having at the grassroots level.
Yes, ma'am. And then another principle is there should be provision for staff development programs. If the staff will keep on working in the same kind of setup at the without any upgradation in the knowledge, because new fields are coming up in the community health, so they should be from time to time upgrade their knowledge by means of in-service education, continuing medical and nursing educations, so that they are aware of the recent changes and advancements. There should be provision for periodical evaluation of the programs and research in the related area. As Madam previously mentioned about evaluation, the feedback is very important, and based upon the feedback of a particular program, the program can be re-evaluated, and one of the best example of this re-evaluation is revised National Tuberculosis Control Program, which was previously known as National Tuberculosis Control Program. So there were, based upon the National Tuberculosis Control Program, certain changes were made. These were called revised, so that it can work in a better way. So these were the basic principles of
Ms.
community
Mehta, for effective delivery of healthcare system and for improving the efficiency, rather for improving the efficiency of the healthcare delivery system in the country, there are certain techniques, modern management techniques which are being used. And what are those, some of the modern management techniques? Would you talk about the techniques which are based on behavioral sciences?
Yes, thank you. As Madam has recently just said, that we want to improve on our services, and when we were talking about concept and definition of community health administration, there also I tried to say that government wants to improve on it, or whatever services are there in the government agencies, we want to have a better coordination, better facilities for the people. How do we do it? We have to adopt some methods and technique. For example, WHO is also one of the organization which is wanting globally the community health services should be improved, and in collaboration with Government of India, it also aims at improving the working of community health agencies and to have better delivery of healthcare services to its people, and to assess or to be able to have better administration or management. It means to get the things done in a better way. There are some methods which can be adopted by the managers to have better implementation of the program. I think Madam Rita has just given you a very right example of revised tuberculosis control program. There was some feedback from the national tuberculosis program, like for example, it was found that people are not taking their drugs. So in revised tuberculosis control program, they try to have dot center where they will call people, give the medicine there and see that there are less default cases. So similarly, there are some techniques of community health administration which are aiming at improving, or which are also aiming at least getting the work done. So there are some methods which are based on the behavioral service sciences, like for example organizational design. All of us work in some or other organization. By organizational design we mean people who are working, what are their tasks which they are doing, and what are their designation, what are their roles in that particular organization. If it is good organization, you are able to have effective administration of that particular agency. But if it is a poor organization, there is wastage of resources, man, money, material. So behavioral sciences, what we understand is that we meet our objective by revising the needs of the community by having proper organizational structure in the particular organization. So it is better to have good organization so that we can effectively use the resources. Madam Rita has talked in the principles that any organization which we have, there is need to have better planning. So even to have proper organizational design, there is need to have better planning. Then next comes is the personal management. Personal management is also based on behavioral sciences. By behavioral sciences, because you have already had in your first year, you have learnt about general psychology, educational psychology and sociology, where we are talking of people, how people behave, how people react, how people are motivated to work, how people are demotivated to work also. So in this personal management, we are talking of skillful use of human manpower or resources. Like for example, if we give proper job description to the people, we give proper task allocation, we also attach some incentives, we also have some way of evaluating the performance, we will be able to have better performance and we will be able to have better community health administration. So personal management is one of the ways of doing, or one of the methods or techniques of community health administration. The next comes is the communication. Communication is the basis of any functioning of any organization. So proper channels of communication, it may be top to bottom, it may be bottom to top. The communication means how we interact with people within the organizational structure. Now communication barriers are also one of the, you can say, barriers for community health administration. Like for example, if there are community health, if there are communication barriers, there will be delay, there will be disruption, there will be under-reporting, or it will also affect its planning. Then next comes is information system. The basis of future planning, basis of functioning is on management information system. Management information system is nothing new term. It means what is the reporting, what is the collection of data, and how this collected data reporting which is done is used for future planning. I think there was some announcement, sorry. So the collection of data, analysis, evaluation plays a very important role in planning for community health services, and that is the job of community health administrator to see that there is a proper management information system. Then comes is management by objectives. By management by objectives we mean the objectives are determined, and to fulfill those objectives we have to do long-term planning and short-term planning. And long-term planning is based on futuristic planning, and short-term planning is to meet the immediate needs or goals of the community. Maybe like for example, if there is an epidemic of gastroenteritis, maybe there will be some short-term planning which will be done to meet the need. But to reduce the infant mortality rate, to reduce maternal mortality rate, we may have long-term planning which may be done in 5-year plans or annual plans of the country. And all these are helping in socio-economic development of the country and improving the health services to the people in the community.
Ms. Rita, she has talked about the methods based on the behavioral sciences. Would you like to talk about quantitative methods?
Yes, sure. The quantitative methods for the effective community health administration are based upon economics, operational research and the budgeting. So as you know, any program cannot be successful unless there is budget or the finances or economics is involved in all kind of budgets. So the first technique of quantitative method is cost benefit analysis. This is a management technique which has attracted the widest attention for application in the health field. The economic benefits of any program are compared with the cost of that program. The benefits are expressed in monetary terms, like we have given the budget and how much we have got the profit. This is the benefit. So in case of health, the benefits are not measured in terms of the money. They are based upon how many lives we saved or how many lives we prevented from getting the disease. So the basis of cost benefit analysis in health is to prevent the illnesses rather than the money. The second is the cost effective analysis. It is again more promising tool for application in the field of health, as well as it is similar to the cost benefit analysis, except that the benefit, instead of expressed in monetary terms, is expressed in terms of the results achieved. Like for example, number of lives saved or the number of days free from the disease. So these are the, in terms of health benefits, we are measuring the
Right,
benefits.
reduction in the infant mortality rate
Reduction.
after giving certain interventions for reducing the
Like-
infant
like
mortality
for
rate,
example, yeah.
and at the end of this there
Yeah,
is
like
some reduction
vaccine
in the
preventable
infant.
diseases are there. They are the killer diseases. So how many coverage we have achieved? If 90% coverage and we are able to achieve the reduced infant
And-
mortality rate, so our benefit is in terms of the
And how
life
many
saved.
cases of various diseases, vaccine preventable diseases have come
Yeah.
down? How many
Now,
cases?
how many there is, like infant mortality rate, previously it used to be 135 per 1000 live births. Now it has come down to almost 60 per 1000 live births. So our benefit is in terms of the life saved due to whatsoever is the cost we have put in purchasing the vaccines.
I think what you are trying to mean is that we are not calculating in terms of money,
Money
but
or
we
the
are,
profit in terms of the money.
we are, even though we are talking of quantitative measures,
Yeah.
it is more of cost efficiency we are looking at,
Yes.
and so we are more concerned about cost effective analysis than cost benefit
Yeah,
analysis.
yeah.
But ultimately the financial people want the budgeting.
Budget.
So they want to know how many days of patient stay we have decreased in the hospital, or
Yeah.
how many people we have prevented from getting the
Getting the
disease.
disease.
I think you gave a very right example by saying that vaccines are bought,
Yeah.
and if less people have got that disease, it ultimately shows that we have saved money in treating those people who would have got sick if we did
Yeah,
not give
exactly.
immunization.
Yes.
So that is what we mean by
Yeah,
cost benefit
very
and
rightly
cost
said.
effective analysis.
Thank you,
yes.
madam. Yes, ma'am. Then another technique of under quantitative methods is cost accounting. Again, it provides basic data on the cost structure of any program. The financial records are kept in a manner permitting costs to be associated with the purpose for which they are incurred. And we have to justify the money we are putting for any kind of material which we are using under any national health program or any thing we are going to purchase for that matter. The cost accounting has three important purposes in health services, like for the cost control, planning and allocation of the people and the financial resources, as well as pricing and cost reimbursements. Again, these are all interrelated to each other, like the number of days patients used to stay after surgery. Previously, patient used to minimum stay in the hospital was 7 days after any minor or major surgery. Now, if we take for example the appendectomy, previously patient used to remain for 7 days in the hospital, but now he can go the same day or next day. He can be discharged from the hospital. Even after cesarean sections, patient used to stay for 7 days in the hospital. Now, if the patient will stay for lesser number of days in the hospital, that means we are saving the cost from the patient point of view also, and from hospital or the organization point of view also. So this is cost accounting. The another is input and output analysis. By input we means the resources we are putting to incur the program. Input may be in terms of the man, material, money, and time is also one of the important inputs we are putting to achieve our objectives. And the outcomes which we are getting are in terms of the, as we have already told, in terms of the life saved. So, and the number of people cured from that disease. So these are the outputs in the health. And this input and output analysis helps to make effective changes in the inputs. Like inputs were more previously, and we are measuring input and output, and based upon our data we can still make effective changes in the inputs. Another quantitative method is system analysis. Like any organization is a system. Nursing education or nursing research, it is a particular system, and we are going to start from the very beginning, like what are the objectives to be achieved, how we are going to proceed to analyze and interpret our data, and then accordingly we implement it, and then try to evaluate at the end. So we are seeing a particular system, studying it in a depth, as well as knowing the effectiveness of that particular system. That is in system analysis we can say. Another last is the network analysis. In the network analysis, it is a graphic plan of all the events and the activities to be completed in order to reach the end objectives. Under this, we are going to study two common types of network techniques. One is PERT, or Program Evaluation and Review Techniques. Slides are there, but I think they are not able to show. And next. I have made a beautiful diagram of the this is a management technique which makes possible more detailed planning and more comprehensive supervision. The essence of PERT is to construct an arrow diagram. I think all of you might be familiar with arrow diagram. It is given in the block also. I have just to be more clear, prepared it. If we can, I think it will not come. Will it be able to show you like this?
Yes, I think we can see it.
Yeah. So if you see the arrow diagram, the planned services are there. We have to, from one activity to another activity, there is a time limit, and that time limit is like to recruit the staff. From after planning, it will take 4 months. 4 months, and then the staff to be trained, maybe taking another 2 months, and then equipment order, or on the other side we are concerned about the equipment required for that particular task. So we are going to arrange them in another 2 months, and then after the staff is trained, equipments are ordered and they have come. So within after that the equipments are installed and the time limit is again given, and everything is now ready. Then we start the providing services. So how much time we need, it will justify from the arrows that there is time limit. You can start the work, how much time it will take, and when at step by step we are going to achieve our objectives. And this diagram represents the logical sequence in which the events must take place. It is possible with such a diagram to calculate the time by which each activity must be completed. So there are many benefits of this kind of arrow diagrams. They allow better communication between the various levels of management. It identifies the potential problems. It furnishes continuous and timely progress report. It forms a solid foundation upon which to build an evaluation and checking system. So this is the one way of network analysis. Another is critical path method, which is the longest path of the network that is critical. If any activity along the critical path is delayed, the entire project will be delayed. So these are the two network analysis. I think.
What about planning programming?
Planning, programming, budgeting system is again in which we have to help in taking the decision. The decision makers are to have to allocate the resources so that the available resources are utilized most effective way to achieve the objectives.
Okay, thank you very much, Rita, for giving nice presentation on the quantitative methods, and I also thank Mrs. Mehta for giving a detailed account of other aspects of the nursing, community health nursing administration. I thank you very much for this.